Hey there, I'm Dr. Jeremy. Do you want to be able to diagnose disease just with your hands? You actually can. You see, when a tissue or a channel loses voltage, it creates a magnetic field that your hand can feel. In terrain medicine, this isn't theoretical. When a channel drops below the charge it needs, it will always produce a magnetic drag. And that's the stickiness you feel when you glide across a channel or a tissue. In this short video clip from one of my recent classes, I'm going to show you how to feel that voltage collapse in real time so you can identify the exact deficient channel or tissue even before you ever pick up a needle. If you haven't subscribed yet, go ahead and do that now so you don't miss any of these trainings. So we're always saying that all disease is a breakdown in terrain, and terrain breaks down from a deficiency of electricity. Then, deeper, acupuncture channels, cells, and blood and the earth need minus 20 millivolts of negative charge, right? When the voltage decreases, the cells no longer function, they can no longer regenerate, chronic disease occurs. So, what does that mean in terms of channels? That means that this is the spleen channel here, and the muscles along the spleen channel should be supplying at least minus 20 millivolts or greater, sometimes over 50 millivolts. When it gets less than minus 20, it creates a magnetic field which creates pain, which makes acuchannels a fantastic diagnostic method for pain. If somebody has pain right here on this liver 13 or gallbladder 26 area, probably the voltage decreased in the liver or the gallbladder or both, and they're linked, aren't they? And then the pain came. Not only does pain come, but a magnetic field gets created which interacts with other magnetic fields like the practitioner's hand. This is why certain points or channels or tissues feel sticky. It's because your magnetic field from your hand is interacting with the magnetic field of the patient's body when it decreased voltage. You can also use static electricity, like the type that comes off of a plastic spoon, if you wanted to glide a plastic spoon over channels or points or tissues, it will stick to the decreased voltage. Questions while I take a sip of my coffee here? Big concepts. I love big, broad, general concepts that can apply to the majority of your patients. How many of your patients have pain? Dr. Trish says, could you say that again? I need to digest it, LOL. Gabrielle says, like using the spoon like a gua sha. Okay, so Gabriella, oh, I forgot. Are there any newbies on here? Because I just started off in deep end of swimming. And Gabrielle says I'm new. Okay. Jerry says I'm cutting out. Okay, let me know if I keep cutting out. And I will switch my microphone. Am I keep cutting out? And Dr. Trish is not here. So, Gabriella, to answer your question, can you use a gua sha spoon? You can use, I'm not sure what your gua sha spoon is made of, but you want it to produce static electricity. I know plastic and rubber produces static electricity, and it will stick to points. Alyssa says, well, stick to points that are more shoe. than others to help us determine which point on the channel would be optimal to needle. That is a great concept. And the short answer is yes, the shoes and the moos are conglomerations so that when the body's voltage decreases, disease happens, it creates a magnetic field that's concentrated over the moos and the shoes, but you'll be able to most likely feel a lesser stickiness on other parts of the channel that aren't the conglomeration of energy. And Gabrielle says, I mean, if like a plastic spoon, like a gua sha. Yeah, I think you can, but practice with just a regular plastic spoon first, because it's the perfect shape and I know it works. And then, you'll feel stickiness and you'll be like, oh, wow, this is cool. And then if you want to try your gua sha spoon, you'll be able to see what it feels like or know what it feels like because you've already done it and practiced with just the regular plastic spoon, if that makes any sense. I like to use fingertips, like lightly glide if you want to right now on the elbow area of your arm. Isn't it 6 channels? You can just go lightly glide your fingertips across the 6 channels of the arm. See if you feel any stickiness. If you do, then that channel is deficient. And Gabriella says, thanks. Yeah. So, and if there's new people on here, I'm going to rephrase something that I said. In electric medicine, we're working with terrain theory. It's different than germ theory. We're electrical beings. Here's the guiding principle. All disease is a breakdown in terrain, whether it's terrain of acuchannels, terrain of cells, terrain of blood, terrain of interstitium. And terrain breaks down from a deficiency of electricity. But not all electricity is created equal. The type in the electric socket is not helpful and can kill you. We want lower amperage or current, higher voltage to be congruent with human cells. Now, Liz says, so glide the plastic spoon along the channel. When it comes to a sticky acupoint, then needle it. Yeah, so look at this here. I'll show you what I'm talking about. Let's pretend this patient has pain here, or let's choose a different one. Let's say sciatic pain. Patient comes in, they're like, I got back pain that starts here and radiates down my right buttocks and down the leg. Okay. So they come in, you have your plastic spoon or your fingertips, right? Or your measuring device. Or you don't even need all that. If they have pain along the bladder channel, it's deficient. If they have pain along the gallbladder channel, that's the channel that's deficient in electrons, right? When I say deficiency, it's a little bit different than acupuncture school, right? I'm not talking about spleen chi deficiencies and, with damp excess. When I say deficiency, I'm specifically talking about electricity, the type of electricity that life runs. So back to your question, Alyssa. Patient comes in, they have sciatica, you're still unsure which channel, gallbladder or bladder. So if you start here, it'll look better like this. Let's say this red dot, my pointer, is the plastic spoon, and you slowly glide over the bladder channel and it gets stuck. That is deficient. And you keep going up, the other branch of the bladder channel gets stuck. Let's say you do that and it doesn't get stuck. And you're like, okay, let me test the gallbladder channel. So then you glide it over the gallbladder channel and it gets stuck, right? So did you see how I did that, Alyssa? Instead of going along the bladder channel, which will be tough because if the bladder channel is deficient, it's creating a magnetic field along the entire bladder channel. So going along the channel isn't so great. This is much better going across the channel. Did that make sense, Alyssa? Now look at here. This is what I just asked you to do if you want. Glide your fingertips. Take a plastic spoon if you got one handy, or glide your fingertips here. This channel, PC, heart, small intestine. You can go all around and diagnose deficiencies in the 6 channels right from the arm. Cool. Let's see here. Did I get that? Dr. Trish, did I repeat what it was? I don't remember what I said. Okay. So we're talking about what pain is. It's a deficiency of voltage. Now, what happens when you get this deficiency of voltage? It turns into pain. The patient comes in, they say, I have pain right here on my elbow. And then you diagnose that as a heart channel deficiency or a PC channel deficiency here. Then you fill up this channel with healing energy, aka electricity. But let's say this patient had this elbow pain for 10 years. And now you filled it for the first time with electricity. And now the cells start regenerating for the first time after 10 years. And that feels like a dull ache. And we call that dachi. And why am I telling you? Because it's important, because sometimes you treat a patient and they come back and they're like, yeah, the original pain's gone, but now I got this other pain, which is dull and achy or pulsing. And I think acupuncture made it worse. No, acupuncture didn't make it worse. That's dachi, the feeling of healing cells and tissues after a very long time of not healing. Does that make sense, y'all? And Dr. Trish said the whole spoon modality, got it. Yeah, thanks. Now, Dr. Trish said, when you fill up the channel, is it point of select on the body and or the ear? Yes. So everything I'm teaching you, and we're going to go more into detail, like all these channels on the body, they also exist on the ear. So I can teach it body if I want to, when in reality, I usually only practice ear, but it's the same thing. There's a connection there that exists outside the nervous system. It's a quantum connection, if you want to use those terms, although I don't believe in quantum physics, but there's a quantum connection between the ear and the body, so that the spleen, let's see here, let me get to the nitty-gritty here. Spleen 21, this point here can diagnose this point here, right? Now, was that, let's be specific. This is a left ear. We need a right ear, because right ear is right side of the body. And I was showing you right side of the body, spleen 21. So a deficiency here at spleen 21 will show up on the ear as a deficiency here. Then if I feed electricity here on spleen 21, it will instantly appear and fill up spleen 21 here on the body, and vice versa. I can diagnose and treat from here, insert electricity here, and it will instantly appear on the ear. Well, it says, sorry, I don't understand a magnetic field conceptually. If there's elbow pain, then the magnetic field is in the elbow, or the channel feeding the elbow, or the neural level feeding the elbow, or the tissue, which we're going to go over all 3 of those during this class. But you're correct in that there is a tissue of the body that can become deficient, but there's also an acuchannel that can become deficient feeding the pain in the elbow, but also there's a neural level
that is feeding, like a spinal neural level that is feeding the elbow has become deficient, but they all link into each other. For example, a channel deficiency that goes on long enough will lead to a tissue deficiency, right? Did that help you, Alyssa? And Alyssa says, my preconceived notion is a magnetic field is like a black hole along the channel that consumes electrons as they flow by. Yeah, that's kind of right. I think of it as chi stealers, or an even better term is chi receivers versus chi donors, or electricity receivers versus electricity donors. So what's actually happening when there's a stickiness here at spleen 21? Well, there's a deficiency of negative charge. The electrical resistance decreased here, and it's ready to accept free mobile electrons. And then, Alyssa, that's pretty difficult. She said, can you describe a magnetic field visually in each of the different areas? That's pretty difficult. I don't think I could do that. Okay. What channel feeds the lungs? And then tell me who's buried in Grant's tomb. So the lung channel feeds the lungs, right? Keep in mind, the heart channel feeds the alveoli of the lungs. But let's keep it simple for this demonstration. A patient has lung cancer, and I keep being reminded about something here because we do have some newbies here. So I'll include this here. This is a pH scale, 0.7 on the pH. 0 millivolts is 7 pH. Minus 20 is right around here when my hand is shaking on the screen, which is 7.365 here. When it decreases less than minus 20, that's a deficiency. When it keeps decreasing, it gets over here. If there's a positive 30 charge, we say cancer forms. So back to here, patient has lung cancer, which means it's a positive charge, which means it's stealing chi, and that will steal chi from the lung channel as well. And this lung mu will become sticky.
When you learn to feel stickiness, diagnosis becomes clearer and far more precise. The body always tells you where the terrain has collapsed. You just have to listen with your hands. Make sure to download the free resource that goes with this training. And if you want to dive deeper with me in more trainings, you can always find it at electro-acupunctureinstitute.com. I'll see you on the next one.